6:03 p.m. Good evening, everyone. Thank you so much for attending this community meeting. My name is Dr. Heidi Joyner, and I am the Assistant Superintendent of Educational Services here in Jefferson Elementary School District. And I will let my colleague introduce himself.
Hi, everybody. My name is Brent Marquez Valenti. I'm the Assistant Superintendent of Human Resources for the Jefferson Elementary School District. I want to thank everybody for coming tonight, and really excited to get this out to you and hear back from you. And I'm putting copies of our plan in the chat box. Please let us know if you can access it.
Thanks, Brent.
Yeah.
So thank you all for being here this evening. Tonight we are presenting our return to in-person learning plan. And tonight we will provide an overview of our plan. We have sent out an email to our community, and in that email consisted of the draft of the plan, as well as a feedback form. And so we ask that you take a look at the draft of the plan and provide any feedback and or questions in the feedback form. If you do not have a copy of the plan, we will be posting the plan on the website in the morning, as well as the feedback form. And Brent is putting the draft of the plan in the chat. Those of you who are in the Zoom room should be able to click on the plan itself and the feedback form. And again, we will post the plan up on the website in the morning, as well as the feedback form.
I just put a copy of the feedback form up. So the last posting was the feedback form link.
Okay, great. Thank you. So, so tonight, again, we are just going to do an overview of the plan. So again, thank you all for being here. So in developing our plan, we have ensured that we use our equity lens, and this has helped us to prioritize the health, safety, and welfare of our students. It's also helped us to provide a rigorous and safe educational experience to all students through the context of the 4 pillars. I will discuss the 4 pillars during this presentation. And using our equity lens has also helped us to decide to bring our most at-risk students back first. We know that our at-risk students, we know all of our students are struggling, but we are well aware that our most at-risk students are having an extremely hard time. And through our equity lens, we're able to engage all of our students with live daily interactions that will meet state instructional minute requirements. So again, using our equity lens, we have helped to develop this plan. So to remind you, on October 14th, 2020, our board approved a baseline for us to return to in-person learning. And that baseline is as follows. The board voted that in-person learning would not begin earlier than January 19th, 2021. They also voted that the health conditions for San Francisco and San Mateo counties would need to meet the minimal tier, which is the yellow tier. And that's the standard across all metrics based on the California blueprint for a safer economy. And that new weekly cases in Daly City are fewer than 30 for 2 weeks. So again, this is what our board has approved. And as of today, we do not meet any of these baselines. So we are unable to return to in-person learning at this point. But when we are ready to return, before we can return, any school in San Mateo County that wants to bring students back for in-person instruction must have a plan that is put together that explains the safety practices and the structures that will exist once students return. And so this plan must be approved by our local board, And once it is approved by our local board, then the San Mateo County Office of Education will need to approve it. So we are putting this plan together in the hopes that, you know, when the health conditions are right and our board approves us again to go back, we will have our plan in place. This plan is a living document, and so we will be updating this plan as the health conditions change and as things change. So we are putting this plan together, but again, we are not at a place where we are ready to return to in-person learning. But when we are ready, we will have our plan together. So back in the summer, we put together a committee, a district committee that was comprised of staff and families. And we began to develop our plan and have discussions on what it would look like for us to return to in-person learning in the fall. And of course, we didn't return in the fall. And so we continued our planning in hopes that at some point we would return to in-person learning. And so when school started, school sites began to bring together their own site committees, and representatives from those site committees then joined our district committee. And so currently, our most current committee meetings have been December 9th, December 14th, and our most recent January 5th. And in these conversations, the committee and the representatives gave feedback on our draft plan. And so this plan was developed by staff, parents, and students with their feedback. And again, we are asking our community to give us feedback on this draft plan.
And if I can interrupt very quickly, Dr. Joyner, the members of this committee were also the standing members of the committees at their site. So they're already working with their school sites to build their individual local plans with more detail. Thank you.
Thank you. So I want to get into a bit of the plan. This is what the plan looks like. And inside of the plan includes the following sections. It has a table of contents, an introduction, guiding principles. Our superintendent has put in a message. There's a section on return to in-person learning. There's a section on the 4 pillars, which we will discuss. And then Appendix A are the definitions. Appendix B, the school site return plans, which every school site has put their plan within our plan, so you can access every school site's plan. And then Appendix C is our student and family supports. And we also have a return to person instruction checklist that we will talk about. So the first section is the phases and timeline. And so just as an overview, and again, if you have the plan, these topics are identified in the plan, and there's a little more detail within the plan. So we do highly encourage you to take a look at the plan. So for our phases and timeline, we will bring our staff and students back in phases. And so our first phase 1, is the staff transition to campus. So before our students return to in-person learning, our teachers and staff will begin a multi-week staggered return to the school site. And during that time, teachers will be able to prepare their classrooms. We'll be training our teachers on how to return to school and how they can train our students to return to in-person learning. But just to give our teachers and staff time to get acclimated back to the new protocols that are taking place within our school sites.
And if I can,
yes,
many of our staff members are actually coming and working out of their classrooms currently, even while they're providing the remote instruction to their students. And our teachers and staffs are working together and making sure that the classrooms are all prepared for the ultimate return to in-person instruction.
So for phase one, just the staff will come back. In phase two, we have identified as our pre-hybrid learning targeted support Wednesdays. So on Wednesdays, teachers and staff will begin providing targeted in-person support to our TK through 5 students. And for our middle school students, if there are small groups of students who need support, they would be able to come back on Wednesdays as well. And during that time, it's our most at-risk students, the students who have the greatest need, would be coming on those Wednesdays. So that's phase two. In phase three, we transition to in-person instruction for TK through 5. And if the health conditions remain constant or improve, that's when our TK through 5 students will begin a staggered return to in-person learning. So in the first week, we would have our TK, kinder, and first graders return. In the second week, we would have our second and third graders return. And in the third week, we would have our fourth and fifth graders return. Our middle school students would continue distance learning until our return to in-person instruction is negotiated for our middle school staff. But again, these things can change based on the transition between the phases can be slowed down if the health conditions change. So if the health conditions, improve, this phased approach will happen. If the conditions regress, then we would stop and make some decisions about what to do next. You're muted, Brent.
And like Dr. Joyner mentioned, we're still negotiating with our bargaining groups, our teachers union, about the conditions of this return. But as of now, we're not, the health conditions in the county is not there. So
Thank you. So let's talk about the 4 pillars. The 4 pillars come from the pandemic recovery framework. And the 4 pillars establish what is essential in creating and sustaining the safest, most healthy environment for students and staff, and to prevent the spread of COVID-19. So the pandemic recovery framework is the document that we're following, and the 4 pillars, we have to address these 4 pillars. And so we will talk about each pillar and how we will address them in our schools. So pillar 1 focuses on health and hygiene. And again, if you have your draft plan, this is just an overview of the pages within pillar 1. So for pillar 1, health and hygiene, staff will use a daily self-screening tool. Families were asking to screen their students before bringing them to school. Students will have their temperatures taken before entering campus daily. Visitors will be expected to have their temperatures taken, and they will answer contact tracing questions. And all employees working on site will be COVID tested every 2 weeks. And this COVID test, we are currently testing our employees who are working on site. We've had 4 rounds of the testing. Go ahead, Brent.
your microphone is muted. I apologize to interrupt. We have
the translation. Thank you.
Yeah, somebody had mentioned that it was muted in the chat box.
Thank you.
Thank you. I apologize.
No problem. So again, our employees working on site will be COVID tested every 2 weeks. And again, we have already started this practice with those employees who are currently working on site at every building. And the employee test is not an invasive test. It is actually a mouth swab. And these recommendations are coming directly from the pandemic recovery framework. So we are taking our direction from this document. So there's the question of when would we close school sites? And again, just to reiterate, the directions are coming from the pandemic recovery framework. And so this is what we are directed to do. So the decision to close an individual school to in-person instruction will be based on the number of cases in the school and the percentage of teachers, students, and/or staff who are positive for COVID-19. The decision will be made following consultation with the San Mateo County Health Department, and individual cases may also revert to distance learning when needed, and that pertains to students who identified as having COVID-19. And again, this isn't something that we've decided, or made up to do. We are again following the pandemic recovery framework, and this is what it states that all schools must adhere to. Brent, do you want to add anything?
Yeah, I mean, again, right now, all students are in distance learning, but should we find ourselves in a situation after returning to school and we were told we'd have to close a classroom or the school itself, we would just revert back to where we are now. So all the students would have their same devices and the teachers would be able to work remotely. So we know it would be a smooth transition because we're already prepared for that. I hope this isn't something we'll have to of course, address really.
Thank you. So along with the health and hygiene, I want to give you some definitions which can help better understand how we're addressing the health and hygiene at sites. So the term cleaning means mopping, vacuuming, removing trash, and cleaning doors and door jambs. The term disinfecting means applying Oxivir 516, which is a CDC-approved disinfectant for the COVID virus. And this will happen every day throughout each campus. Okay. In addition to cleaning and disinfecting, each classroom, workspace, and bathroom will be cleaned using an electrostatic disinfectant sprayer to disinfect workplace surfaces, chairs, tables, which is to protect our staff and students and to reduce the risk of the spread of the infection.
These are those same sprayers you've seen that they're doing on airplanes and in businesses. We've already been doing that on school sites and in the offices. So all the equipment's been provided to the school sites, and we're very prepared for this.
We also have air handling systems that are equipped with recommended filters, which will run all day to maximize outside air. We will open classroom doors and windows at all times, weather permitting, during instruction when students are present. We'll also utilize outdoor space for instructional purposes, weather permitting, and as much as possible. And we're using portable HEPA filters and fans when appropriate to increase our outdoor air ventilation. Brent, any additions? Okay, thank you. So these, okay. So how often would our cleaning take place? And so this is our frequency of cleaning, and this is identified in the plan. Workspaces, which we identify as classrooms and offices, we would be cleaning at the end of each use and at the end of each day. Appliances, which are refrigerators, microwaves, coffee machines, would be cleaned daily. Our electronic equipment, which would be copy machines, shared computer monitors, TVs, telephones, keyboards, will be cleaned after the end of each use, at the end of each day, and between use. So if I'm using a copy machine, when I leave, it'll be cleaned so that the next person can use the copy machine, and it will be cleaned at the end of the day. General use objects, which are handles, light switches, sinks, and restrooms, will be cleaned at least 4 times a day. And our common areas, which are our cafeterias, libraries, conference rooms, gyms, and common areas, will be cleaned at the end of each use and at the end of each day and in between groups. So if a group of students go into the library, when they leave, the library will be cleaned down and the next group of students would be able to come in. So if there's any questions about the frequency of cleaning, please take a look at the plan, as this document is located in the plan. Brent?
Yeah, a question has come up in our meetings, to be transparent, about all this extra cleaning that needs to be considered and how that will impact our current custodial staff's ability, given the tasks they already have to do. And it's a good question, because it is a lot, but we also are not going to be having lunch on campus like we've had in the past. Recess will be very different. So there will be a shift of duties onto more focusing on the frequency and maintaining the cleaning that we're talking about here. Also, we'll have schedules for use of bathrooms for students and going in and cleaning those bathrooms after each group comes through. So this is a real big part of our plan to make sure our students and staff are safe.
Thank you. Excuse me. So we will move on to Pillar 2. Pillar 2 focuses on face coverings. Excuse me. So to give you the definition of a face covering based on our pandemic recovery framework, a face covering is made of cloth or fabric or other soft or permeable material without holes, and it covers the nose and the mouth and the surrounding areas of the lower face. Masks with a valve device are not allowed. Excuse me. We will provide disposable masks at the school sites for students, staff, and visitors who forget their masks or their mask becomes damaged. So each school site and office has masks located in the school. And we do encourage every student and employee to bring their own mask, but again, we do have masks for every student and staff. Face shields are not suitable substitute for masks, but they can be used in addition to a face covering. So if you're wearing a face shield, you also have to have a mask on with the face shield. Face shields are not suitable by themselves. All right. Oops. Sorry. So Pillar 3 focuses on physical distancing. Our classrooms are being set up so that desks will be spaced 6 feet apart, and teachers will have their own area, which will be 6 feet apart from the students. As well, the restrooms will be assigned to cohorts of students. Face masks are required in the restrooms, and no more than 2 people at a time may be in a restroom. And so once students arrive back to campus, they will be apprised of which restroom they should go to, and that will be the restroom for them.
And
Right.
just something as a reminder that when we do return to in-person learning, we'll only be having up to 12 students in the TK to 3rd grade per day, and up to, I believe it's 16 students in the 4th grade through 8th grade. So it's only going to be half of the students per day in the classes. It'll still be tight, and some classrooms are different sizes, but we've already done the moving of other furniture to allow for the physical distancing.
Thank you. So pillar 4 focuses on limiting gatherings. So until further notice, all school-wide events will take place remotely. There will be no after-school sports, and unfortunately, there'll be no on-campus volunteering. As for lunch, so for those students who are coming in person, those students will receive, and this is at the end of the day before they leave, they will receive a lunch and supper for the day, and they will receive a breakfast for the next day. And they will take all of this home each day that they are in attendance. On Friday, these students will receive food for the weekend to take home and the breakfast for that Monday. Those students in distance learning will receive meals from the school they are enrolled in on Tuesdays, Thursdays, and Friday from 10:30 a.m. until 1:30 p.m. Siblings will need to pick up their meals from their respective schools. So if, one student is in an elementary school and they have a brother or sister at one of the middle schools, they will need to go to the middle school to pick up their siblings' lunch, breakfast and lunch and dinner.
And I was just going to say, as we are still in distance learning, we do have we're going to continue with our program where families can pick up their food for multiple days and keep it at home.
Yes.
So if you have any questions, please feel free to contact the district or your child's school.
Yes, thank you. All right, so we've covered the 4 pillars. Our next steps, what are we going to do? So tomorrow, January 8th, this draft plan will be posted on our JESD website as well as the community input forum. And again, we really encourage you to review the plan and provide any feedback and or questions on the feedback form. In January, we are submitting our plan for board approval. So we'll review all of the feedback and make any tweaks and or additions, and then submit our plan for board approval. And once we get board approval, we'll continue to monitor the San Mateo County health data. We will provide ongoing training and support to those teachers who will be returning to sites, which are our hybrid teachers. And once our health conditions get to a place where it is safe to return, we will begin to bring students back in a phased approach as the conditions allow. So we thank you for attending our overview of our plan. Again, we highly encourage you to review this plan and provide any feedback and any questions. If you have site-specific questions, we encourage you to reach out to your administrator and send them an email and or call. Sites, their plans, again, are embedded in this plan, so take a look at your student school site. While the school site plans are not finalized, they are following the guidelines set in our district-wide plan. And so, just as I said earlier, our plan is a living, breathing, fluid document. So are the school site plans. But the school site plans have more information dedicated to the individual school site. Our district plan is a district-wide plan. And again, if you have any questions, you can please add them to the feedback form. And we will produce an FAQ in the coming weeks of those questions and send them out with the answers, of course. So thank you all for attending this evening. I hope that you've learned something new and that we have been able to answer some of your questions that you've had. We definitely want to be transparent in the work that we're doing and in our approach to returning to in-person learning. And please be clear, we are not ready to return to in-person learning. We do get feedback that says, please do not return today or please do not return right now. And we are not planning to return anytime until our county health data changes and we, begin to have those discussions. Brent, do you want to say anything?
Yeah, just want to say again, like Dr. Joyner mentioned, thank you all very much for joining us this evening. In the return to in-person learning plan, there's many links that will bring you to the pandemic recovery framework and lots of the information that we are responsible for following as we move in the direction of returning our students to school. Please pay particular attention to the site plans as well of your students' schools. They're really looking forward to getting feedback on that, and as are we. If you have any questions, please contact us. It'll be up there. I'll be, like Dr. Joyner said, updating the plan with feedback and keeping it posted on the district website. And thank you and Happy New Year.
Yes, Happy New Year. And for those who are needing translation, when our plan is finalized, we will get the plan translated into your home language, and we will send an email out to let you know that it's uploaded on our district website so that you'll be able to have the plan in your home language. So again, Happy New Year. Thank you all for being here, and have a great evening. Take care.
Thank you, everybody. Have a good evening.
And thanks to our wonderful translators.
Yeah.